Seasonal affective disorder is a type of depression that happens seasonally, usually in the winter. Seasonal affective disorder begins and ends about the same time every year and is recurrent. If you're like most people with seasonal affective disorder, your symptoms start in the fall, persist through the winter months, and start to get better in the spring. Symptoms are moodiness, lack of energy, difficulty concentrating, lack of interest in activities you normally enjoy, sleep problems, feelings of hopelessness, cravings for carbohydrates, and a subsequent weight gain. Thoughts of death or suicide can creep in, and you should seek medical care. Most of the time, seasonal affective disorder happens in the winter, but some people can get it in the spring and summer. In people with bipolar disorder, spring and summer can bring on mania, or a less intense form of mania called hypomania, and fall and winter can be times of depression. It's normal for everyone to have some days when you feel down, but if you have extended periods of feeling down, you should be seen by your healthcare provider. The specific causes of seasonal affective disorder are not known, but some things are associated with it. This includes changes in your circadian rhythm or biological clock. Decreases in sunlight can interfere with your body's clock and cause symptoms of depression. Decreases in sunlight can cause decreases in serotonin levels, and this can lead to depression. Your body's melatonin levels can be affected by the lack of sunlight, and this can precipitate sleep and mood problems. Seasonal affective disorder tends to happen in women more than men, and having blood relatives with seasonal affective disorder increases your risk of having it. Having bipolar disorder or a history of depression are also risk factors. Living far from the equator and the subsequent shorter winter days is an independent risk factor. Seasonal affective disorder should not just be chalked up to the winter blues. It needs to be taken seriously as it can worsen and be harder to treat. Worsening seasonal affective disorder can lead to social withdrawal, problems with work or school, interpersonal problems, anxiety, eating disorders, substance abuse, and suicidal thoughts or behaviors. Diagnosing seasonal affective disorder includes a good history and a physical exam and lab tests, such as a complete blood count and thyroid testing. Filling out questionnaires or seeing a mental health professional are helpful. Treatment may include light therapy, medications, and psychotherapy. If you have bipolar disorder, make sure you let your provider know because light therapy and antidepressant medicines could potentially trigger a manic episode. For seasonal affective disorder, light therapy is a first-line treatment and generally starts working within a few days to weeks and has very few side effects. Some antidepressant medicines work well for seasonal affective disorder, and your healthcare provider can help you with that. Psychotherapy or talk therapy is another mainstay of seasonal affective disorder treatment. Relaxation techniques, meditation, music or art therapy, and guided imagery are techniques found to be helpful. Don't try to tough this out and suffer through. Your healthcare provider is there to help you. And remember to call an elder. They've been waiting for your call. I'm Dr. Arne Vainio, and this is Health Matters.